So lupus is one of those autoimmune diseases where it technically can affect literally any tissue in the body. And so when managing lupus, it's about seeing where do people's symptoms lie right now and having awareness and sort of keeping in the back of my mind what symptoms could they experience if the disease were to travel to different places, and really keeping an eye on, are there markers that I can track? So for example, I want to look at liver enzymes and make sure that there aren't any early warning signs that the disease is moving into the liver. Same with the kidneys. And so the thing with lupus is not so much what's consistent between all the patients, but keeping in mind what it can do and managing. So lupus is one of those autoimmune diseases where I've seen children with lupus and I've seen adults with lupus. I've seen many adults who retrospectively have realized they've had lupus symptoms for most of their lives, but often aren't diagnosed until they're in that sort of mid-40s, early 50s range. But perhaps have had the butterfly rash across their cheeks on and off since they were 15, 16, or perhaps have had random aches and pains in their joints or in their muscles, again for a long time, but nobody ever thought to look for lupus antibodies. When it comes to all autoimmune diseases, there are tests that should be good markers. Many people don't necessarily fit nicely into those boxes. Lupus thankfully has more extensive testing that tends to be a little more accurate, but it is also still a combination of symptoms, which autoantibodies are present and in what amounts, and then just looking at the overall course of the disease.